Good morning, Acton, and welcome to Java with John, hosted by Town Manager John Mangiaratti. Java with John streams every Friday morning at 10 a.m. on ActonTV's YouTube channel. You can also listen live on the radio at 94.9 FM. Tune in weekly for important information from the Town Manager, Health Department, and Council on Aging, as well as a variety of special guests. Residents can contact us with questions or comments at 978-929-6611 or email manager@actonma.gov.
Good morning. Welcome to the Java with John program. Thanks for tuning in this week. It's March 12th, and we are 1 year into a different way of operating in this local government and talking with you virtually every week. And it's we're marking this year, and there's been a lot of loss and a lot of hard things that happened, but there's also been some positive things which I like to try to focus on. I hope you had a chance to check out the budget message where we highlighted some of that over the last few weeks. But we have a show today with some important updates from folks from without the organization. I will go to them later, but I'd like to just introduce everybody quickly. We have Sharon Mercurio, our Council on Aging Director, Chief of Police, Rich Burrows, Public Health Nurse, Heather York, and the Chair of the Council on Aging Board, Ellen Feinsand. And we are going to talk to all of them in a moment. I just wanted to give you a few updates on things that are happening here in town. There's a Board of Selectmen meeting on Monday night. We will start to talk about more of the budget process. We're planning a joint meeting of the Board of Selectmen and the Finance Committee for March 29th to present the town's new 10-year capital plan. And then the Board of Selectmen joint workshop with the Finance Committee to look at all the departmental budget requests is going to be April 6th. So mark your calendars and check those out. There'll be virtual meetings, and it'll be a great way for you all to learn more about the budget and what we're proposing to do this coming year. A lot is happening with reopening. You're watching the state with news about vaccines and news about changing the phases, and Heather will touch on a little bit about that in her comments. But just generally, I want you all to know that we are working as an organization to talk about our reopening plan and bringing people back into our buildings when we can do so safely. We know the schools were mandated to reopen, some of them in less than a month from now, at that timeline, and trying to understand what we can do to continue to provide more services to the community. Our window services at Town Hall will be opening very soon if they haven't already. So that's going to be another opportunity for you to engage with our staff. And we're going to work to a position where we can start having people back in the buildings. And we'll certainly talk to the Board of Selectmen and the Board of Health and others about that before we make those decisions. But just so you know that we are planning and working very hard to do that. So on that note, why don't we talk more about where we are from a public health standpoint? Heather, how are we doing this morning?
Morning, John. How are you, everyone? So today in Acton, we are at 800 overall positive cases in the town of Acton, with 20 people in isolation currently. So the numbers have definitely gone down in the last few weeks, which we're glad about. Everyone is still doing their best to keep the spread slowed or at a much less active level than we were having through the holiday season and the very beginning of the year. So that's good news. We're following the trends that the state is seeing with lower numbers. Household transmission still seems to be the biggest increase in Acton, and that's been seen across the state. So John did mention some changes that the governor has put in place. Most recently this week is a change to the travel guidance related to vaccines. So anyone who has had either the Pfizer or Moderna second dose or the Johnson & Johnson single dose vaccine, after 14 days of being vaccinated, you do not have to be tested or quarantine when returning to Massachusetts if you're a Massachusetts resident, or if you live outside of Massachusetts, you don't need to do either of those things. So that's a big change for travel orders. Something good that is moving forward with our vaccinations, which is definitely good news. The other thing that goes along with that is any exposure that you may have had to a positive COVID case. If you've been vaccinated, so that same timeline of the 14 days have passed since the second dose of your Pfizer or Moderna vaccination or the single Johnson & Johnson dose, you do not have to quarantine as a close contact or be tested after that exposure. So that's really good news for people too, because as there have been, multiple exposures for some people in the community related to family or work, especially work related, or schools, sports. It's good news that people aren't having to be tested repeatedly if they are exposed, if they've had that vaccination. So that's definitely good news. The other thing, and there's a little bit of difference between what the state is giving for information after vaccination for people who can start gathering together as opposed to the Centers for Disease Control. So the Centers for Disease Control did put out that people that are vaccinated can now visit with others that are vaccinated without face coverings or social distancing. Now that is noted on the state website, but the state is still has the mask mandate, has the social distancing mandate. So those are all still in place, and that has not changed for the state of Massachusetts. So, as days move on and more people are vaccinated, I think that the state will become more in line with the CDC, so that we can start doing, more things that we were doing previous to this entire year. As John may have mentioned, we're just about at the year mark when we became in a state of emergency. So we're moving forward, we're getting there, and that's good news. On our vaccine front, we have done a number of small clinics, both at the Windsor Green Housing Authority and also at the R.J. Gray Junior High. We are getting very, very limited supply. As of today, we haven't received any additional first doses, unfortunately. But if that changes, we will get notification out to you all. We are working on a possible regionalization request with the state, with 7 other towns, trying to get some vaccine into our neighborhoods. So more on that as it comes. Hopefully the state will start identifying some of those regionalization locations, and hopefully Acton is one of those. That's about all for me. Thanks so much, and everyone have a good day. The weather looks great today.
Thank you, Heather. Nice job. Sharon, how are we doing today? What's new with the Senior Center?
We're doing well, thank you. So we continue to do our programs virtually. Really grateful for ActonTV because our exercise classes, line dancing, various lectures, yoga, all of those are available to you on ActonTV and on ActonTV on demand. So if you're a night owl and you'd rather not get up to exercise at 8:30, have at it. Go on demand and exercise whenever you like. So again, trying to find those positives during this. And I think that's one positive, is that we're able to still give services to people and kind of in their own homes. So we're actually seeing some new participants, which is great, that maybe weren't able to get to the senior center or may have been a little self-conscious coming to the senior center. So it's great that we're seeing new participants even during this time. So what we have going on this week, later on this morning, the America's Writers program will be at 11 o'clock. Monday, the popular Words Galore is at 2. On Tuesday at 11, we have District Attorney Marion Ryan here. Really, she's seen it, and I know our own local police has seen a huge increase in scams and frauds during COVID-19. And Detective Michael Racklio will also be on that program as well. So she'll be talking about what she's seeing in the state, and Mike will be addressing what he's seeing more locally and what you can do to protect yourselves. On Wednesday, St. Patrick's Day, we're going to be doing a drive-through lunch. It's not corned beef and cabbage, sorry. It's going to be roast beef sandwiches. I really was not sure how corned beef and cabbage would travel, so we played it a little safe. But then you can go home and watch a musical program. The Tin Pan Alley music program will be at 1 o'clock on Thursday. Laugh for your health. And just a reminder for folks to spring ahead. So don't forget to turn your clocks ahead this weekend. That's all I have. If people need help filling out the interest form for the vaccines or have questions, feel free to give us a call. Our number is 978-929-6652.
Spring ahead. That sounds really good. Can we do it right now? When do we do it? Is it just 2 o'clock in the morning or something? Or I just let my iPhone do it automatically.
I do it before I go to bed.
Well, that's very exciting. I can't wait. So the daylight is gives everybody some extra energy. So it's exciting. Speaking of extra energy, Chief Burrows, you've been on the circuit this week. We saw you earlier at the League of Women Voters Forum, and here you are this morning on the Java program. What's happening? How are you?
I'm doing excellent. We are here to talk about the recent accreditation of the Acton Police Department, which is a great accomplishment. And before I forget, speaking of ActonTV and Watch on Demand, Sergeant Christopher Hodges was promoted last month, and that's available on the YouTube channel as well. I have a quick PowerPoint if I'm going to share my screen for a second here.
And accreditation is a very big deal, and we're all very proud to have this accomplishment. We look forward to learning more about it.
So we recently received the accreditation from the Mass Police Accreditation Commission. There is a accreditation program nationally called CALEA, C-A-L-E-A, but it is a huge undertaking, over 500, close to 600 standards. The Acton Police Department got nationally accredited back in 1992. It was a huge accomplishment, a huge undertaking, but it was a little too much to maintain over the years. There's a lot of compliance that goes along with it. So Mass Police Accreditation, recognizing that a lot of departments in the state didn't have the capability to meet the CALEA standards, they went out and looked at all the CALEA standards and identified 159 standards, the real meat and potatoes of what you need to do if you're a police department. And that talks about use of force. It talks about the prisoner processing, your physical plant, all the different evidence room processes, processing the evidence, and then evidence room inspections and maintaining the consistency of the evidence as it's processed through the department, brought to court. Chain of custody is the word I was looking for. Sorry, I haven't had my coffee yet. So the Mass Police Accreditation is a state board, a state commission, and this is how it consists of 6 members from the chiefs of police, 1 from the Mass Municipal, 1 from Mass Police, and 3 are elected by the board. The state certification, there's 2 levels, certification and accreditation. The lower one is 159 standards, and those are officer, public safety, high liability, risk management, and generally promote operational efficiency throughout the agency. There's one thing to have a policy that says, what you have in the cruisers, but the important part of the policy is who's going to check to make sure that the supply is maintained, and where do you go to fill it when you need to fill it because something was used. So those are important to get certified, and then every 3 years you go back to get recertified. And the important part is showing that you maintain those policies and you maintain whatever needs to be done to keep those policies up to date. And those evidence room inspections are done, those cruiser inspections are done. Then the higher level is the state accreditation. It's 257 standards, so it's a little bit more, but it's the highest level that you can obtain in the state. They're generally conducted over 3 days. There are assessors that come in. They're trained through the Mass Police Accreditation Commission. And because we got certified in September of 2019, we had very good records. We didn't have a lot of compliance to show over that almost a year. So we were able to finish it in one day. Our accreditation team was absolutely great. Doug Sterniolo, Lieutenant, Sergeant Fred Rentschler, and Detective Doug Mahoney and Officer Mark Symington consisted of our team. And the on-site assessment, they came through, they do a physical tour, but because of COVID, we actually had a PowerPoint presentation that went through all the different parts of the department, so they didn't have to leave the EOC to do the typical walkthrough. All the requirements are met. There's a summary of the agency's assessment. It's provided to the commission. They review it, and then they make a decision whether or not they're going to award the actual accreditation. So we were assessed back in October, just before Halloween, and we were given the accreditation on January 20th at the commission's next meeting. So we will be back up again in 3 years to get re-accredited. So that's the real brief overview of the accreditation process. To show how in-depth it is, our insurance company comes out to every building every year and inspects all the buildings to make sure all the exit signs are lit, to make sure all the fire extinguishers have been inspected. And when they walk into the police department and they see the accreditation or the certification on the wall, the inspector opens up his book and crosses off like pages 2, 3, and 4, because those are all the physical plant that they usually check, but they know the accreditation's on the wall, so they know all the standards have been met. So that's the overview.
Thanks, Chief. Yeah, another example of how a professional operation that you run over there. So thank you for getting that achievement with your leadership and the group that you've assigned to it over the last few years. It's something I look forward to maintaining with you, and a good sign for the town.
Thank you.
Any other updates? Any public safety updates while you're here?
I would encourage everybody to tune in to Marion Ryan's scam presentation next week. That's going to be a great presentation. And like I said, Mike Araclio, who handles a lot of those things for us, will be working with her. So she'll talk about what she sees across Middlesex County, which is kind of big. It's the 19th largest county in the United States. But Mike Araclio will kind of bring it into what we're seeing locally.
Great. Thank you. And thanks for all your work. Our next guest, Ellen Feinsand, is the Council on Aging chair of the board for the Council on Aging. Ellen,
thanks very much.
What is the Council on Aging, and what do you do?
Thanks for inviting me today. The Council on Aging board has a similar name to the Council on Aging, which we fondly refer to as the Senior Center. The Council on Aging board is dedicated to advocating for Acton seniors and elders. We aim to stay on top of issues that are important to Acton seniors, such as things relating to housing, transportation, all with the goal of staying healthy, being active, and being happy to live in Acton. We contact the state and federal legislators to ensure there's awareness of Acton's senior and elder needs. And we are always willing and interested in hearing from families, seniors, elders, and anyone who has an idea about how we can do more in our advocacy. Members of the COA board serve as liaisons with other Acton boards and committees. Given that there are about 1/5 of the residents in Acton are over 60 years old, it's an important segment of the population. We serve as liaisons in areas that impact Acton seniors. So our members are responsible to raise awareness of seniors' needs and work together with the COA board and the other boards and committees to identify possible issues and work towards solutions. Examples of key liaisons are with the Acton Board of Selectmen, with the Acton Community Housing Corporation, the Acton Housing Authority on affordable housing matters, the Transportation Advisory Committee, things helping to make transit options for seniors better known and used, and hopefully after the pandemic rules, more available. And also working with the Commission on Disabilities for accessible parking and other things, because not everyone who is a senior is disabled, but many people who are disabled have seniors in their orb. The COA board has identified issues recently associated with a potential development project at 67 Powder Mill Road. We have documented our concerns and shared them at a recent Board of Selectmen meeting, all with the goal of making sure Acton's senior and elder population is better understood and its unique needs are well documented and communicated. So we're always interested in your comments and in any ideas from Acton residents, whether you are a senior citizen or may become one someday. The information you want brought to our attention is very important to us. So to reach us, you can send an email to our website, to our email address, coa@actonma.gov. Thank you, and we wish everyone health and a long life so that you can be a senior or an elder resident of Acton if you choose. Thank you.
Thank you, Ellen, for all the information. I have a question. Do you mind?
No.
How many members are there on the board?
We have 9 full board members and 2 associate members. We meet once a month, and we sometimes have guests and we have visitors. This week we heard from some outside guests on a project that is going to be discussed in an upcoming Board of Selectmen meeting. It's relevant to seniors, and we must have a quorum of 5, but we almost always have a quorum. And now that we do them online, blizzards don't stop us. So that's a good thing.
It's certainly been one benefit. They don't have to be rescheduled anymore like they used to.
Right. That's right.
I remember I've been to a few board meetings. I look forward to coming back someday soon.
We hope so too. Certainly the seniors would like to. We'll tell you just one other thing that we're cooking up together with excellent staff at the Senior Center, and that is, now that we know the sun is going to be out more minutes a day, we're thinking of ways we can get people to join in activities outdoors. And we hope that that will be a good transition until we're able to resume, maybe in 2022, activity indoors.
Outside activities were very popular, and it's nice that the snow is melting, and we'll start doing that again. So look forward to hearing more about that, and you can come back on the program and talk about it.
Absolutely. Thank you.
All right. Well, thank you all for joining us this morning, and I hope everyone has a relaxing weekend, and we'll see you next week.